A lot of patients want to know when it comes to OrthoSculpt, what are the things that I need to avoid before surgery and after surgery? What are the most common complications? Questions about when they can get back to work, when they can start working out. So what I tell everyone is when you're going to have surgery of any kind, being healthy in general is key. So you should eat healthy leading up to surgery. There are medicines and supplements that can interfere with healing that actually can lead to complications like medicines that thin your blood. So you want to stop any medicine that thins your blood, and that includes prescription medicines or over-the-counter medicines like non-steroidal anti-inflammatories. That's Motrin, Naproxen, Aleve, Advil. Before surgery, anti-inflammatories increase your bleeding. After surgery, they decrease inflammation. Well, unfortunately, inflammation is necessary after surgery. That's how our body heals. So we don't want to stop that process. So I tell everyone, avoid those medications for at least 10 days before surgery, and then for at least 3 to 6 weeks after surgery. Vitamin supplements, I tell everyone to stop about a week before and probably not to resume until at least a week after. And that includes anything like turmeric or anything that decreases your inflammation that's natural as well. When it comes to working out, you want to avoid exercise heavily in the beginning because you want to let your body heal. If you're moving and turning, what can happen is fluid can accumulate, blood can accumulate under the skin, and it can compromise your results. It's really important that after these types of surgeries that you're walking and that you're active, but nothing strenuous. So you can't work out in the gym till at least 6 weeks after surgery, but you do want to walk 5 times a day to get things moving to avoid blood clots and pneumonia, just the medical complications of having an operation. You want to probably wait about a week before you go back to work. Most people are able to return to work within 5 to 7 days. Some people need a little bit longer. It does vary from person to person, but a week is a pretty good average. Infection is always a risk. Anytime you have any incision, whether it's small or large, you can get an infection. So being really careful with your hygiene before surgery and after surgery is very important. The way the wounds are changed, the way the dressing is taken care of, never putting your wounds under water for 6 weeks, changing your dressings daily so that they're not sitting there saturated, and then making sure you're always cleaning your hands, or whoever's changing the dressings for you are always cleaning their hands before they ever touch your wounds, and gloves, of course, before you ever put a dressing on the wounds. Specific to liposculpture is you want to wear a compression garment. Those compression garments vary in time. I think the longer you're in a garment, the better it is. And one of the most essential things about OrthoSculpt or any kind of liposuction procedure is post-operative massage. You want to make sure that the fluid is being massaged on a daily basis for a minimum of 2 weeks. And that's when, for me, I begin this scar massage treatment. A lot of times these surgeries create thickening of the tissue, scarring that gets really dense. We call that in medicine induration. Induration makes the tissue feel real thick and woody. So what you want to do is you want to begin doing scar massage. And what's really good about scar massage is that it thins and softens the tissue and the scar. It also helps soften the appearance of the healing of the wound. And so those are really important parts of healing when it comes to OrthoSculpt.